Well, what we hope people will do is use this as an opportunity to reflect on whether or not these types of hazards exist in their institutions. Some are more applicable to one setting than another, and then there are other topics like care coordination and medication safety that are relevant to the entire continuum of care. So we hope that people will reflect on this and see whether they have good processes in place for dealing with these particular hazards. Issues around clinical alarms are coming up not just within ECRI Institute PSO, but throughout ECRI. And that's one of the reasons that it got to the top of the list. Another reason is that it's a compliance issue. So Joint Commission has a requirement that clinical alarm management practices need to be in place by 2016. So this is an issue that's getting major focus this year. When we look at health IT related errors that are submitted to ECRI Institute, about half of them relate to data integrity in one way or another. Wrong information gets into the patient's chart, correct information gets into the wrong patient's chart, or information doesn't get put in at all. So how the EHR is used is leading to patient safety issues. If we don't find a good way to deal with that, it's something that could potentially limit the effectiveness of things like clinical decision support and the electronic medical record that we've spent so much time and money investing in over the last 5 years.
We consistently get reports to the ECRI Institute PSO of various descriptions of violence in the healthcare setting. One of our hospitals told me, when in the context of a request that they were making for specialized information, that they see as many as 15 of these cases a day, every day, 365 days a year in their hospital. When a patient acts out violently or becomes violently agitated, that's really a psychiatric emergency or an emergency situation that really needs acute intervention immediately. The facilities and up to the leadership level need to acknowledge that violence is taking place within the walls of their facility. It's very frightening. It's outside of the scope of regular competency for many healthcare workers. And sometimes they're feeling challenged that their hospital isn't providing the resources that they need to handle these kinds of situations. You certainly want to be aware of any behavioral health resources in your community and in your hospitals. Some hospitals are trying rapid response teams for behavioral health and violence. Understanding de-escalation techniques is also a good investment for frontline staff.
So medication safety errors make up close to 25% of all of the adverse events that are reported to us. And then within that category, a large percentage of those are related to weight-based dosing errors. And then within that category, the pound-kilogram mix-up was a top contributor. Unfortunately, I can relate personally to this issue. We took our son into a local emergency department for a respiratory issue. What happened was he was weighed in pounds, so as a 2-year-old, he was around 30 pounds, but apparently it was put into the system, to the electronic system, in kilograms. The medication was calculated based on a 66-pound toddler, and therefore the medication was doubled. It was really only because I work here at ECRI that I knew that a medication error was of concern, and I actually asked the nurse and the physician, is this amount based on his weight? But I think the easiest thing is to get rid of scales that weigh in pounds. I know many organizations do have scales that you can toggle between kilograms and pounds, but if you only have scales that weigh in kilograms, that takes that potential error out of the equation at the start. Another tool that you can look at is a clinical decision support system, and that will help alert providers if there is perhaps a question about the patient's weight. But if we really stop and think about, this could happen to me, or to my child, or to my parent, I think it provides us with a little more incentive to try and affect change in a high impact and systematic way.